Hey guys. Okay, so this is my attempt at making a video about mental health and some possible ways to keep it under control, or maybe to deal with anxiety when it's in an acute phase. I've made a video about mental health before, but it was a really long time ago, and I feel like a lot has changed since then, and I wanted to, talk about it some more. So I guess I'll kind of recap, because lots changed, and also, new people are watching this, so, yeah, recap. So about a year and a half ago, I was diagnosed with severe anxiety, like a panic disorder, and now depression. And I was diagnosed with this before I was diagnosed with gender identity disorder. Although me realizing I was trans and my anxiety did manifest at a very similar time, which I don't think is completely unrelated. So I was diagnosed with a severe anxiety disorder because I was having multiple panic attacks per day. I was finding it very difficult to leave the house, finding social situations virtually impossible. Crowded spaces, terrible. Bright spaces, terrible. I found it really difficult to take off my sunglasses when I was in public. I didn't like people looking me in the eye. And the feeling behind this was that I had this feeling of impending doom. I think that's the best way I can describe it. I felt like quite constantly that the world was in this dire state and there was nothing I could do about it. And I was so out of control of what was happening in everything, the universe, the cosmos, existence. I guess I was having a very intense existential crisis. And these thoughts were quite, I guess, verging on obsessive. I couldn't control them and I couldn't get them out of my mind. And they were really scary. And those thought patterns then began to manifest in physical symptoms. So I would have panic attacks where I would feel like I was unable to breathe. I would get really blurry vision. I'd find it difficult to hear things properly. Like I couldn't concentrate on what people were saying to me. Loud noises would make me feel really nauseous. I would often feel like I needed to go to the toilet suddenly, out of nowhere, and need to vomit. This really intense nausea. And this was difficult, trying to live a normal everyday life with work. I work full time, friends, family, relationships, all that sort of stuff. It started really impacting on my everyday life to the point where I ended up taking quite a lot of time off work and had to spend a lot of time really figuring out how to get this under control. And after about 8 months of therapy of trying to pinpoint exactly what I was feeling anxious about, sort of came to terms with the fact that I was struggling with my gender and that I was struggling a lot with the sort of existential crisis of the world being out of my control, and maybe that the world wasn't this safe, secure place you kind of imagine as a child. That it is a scary world, and we live in a scary time. I know I'm privileged. I live in a first world country, and I definitely have first world privilege. I'm white. I have a university education. I live in a country that has missed the recession, but nonetheless, we still live in a scary world. And I was definitely perceiving the world as very, very scary. And it was really, really impacting on my everyday life. So the first thing I did was freak out. And I'm really lucky. I have really good friends and a really supportive family, and a family that is very understanding about mental health. My mum in particular was a really good support to me at this time. I would call her at all hours of the day, in hysterics, tears, not understanding what was happening to me, and she was very good at talking me down. And eventually, my mum and some friends convinced me to go to the doctor, which was a really good decision for me. And I started seeing a counsellor, who I'm still seeing now. I've been in therapy for about 2 years. I go I used to go every week. Now that it's more manageable, I go once a month. And I find that really, really useful to just get a objective opinion about things, someone to challenge me. I often find that because I'm quite good at arguing a point, and I'm quite, maybe not necessarily on camera, but often I'm quite well spoken, I can kind of convince people that I'm right, even though what I'm saying is a little bit far-fetched. I find it really good to have a professional to kind of be like, well, yeah, there are these terrible things in the world, but look at all the other stuff. I guess to help me gain a more logical perspective, it was really helpful. I had a lot of hesitations going into therapy. I thought it kind of was like admitting that I was insane, but I think that's a really immature response to therapy. It's like, if you have the opportunity and the privilege to go and talk to somebody who wants to help you, why would you not take that? It shouldn't. I mean, mental health is stigmatized in our community. In a lot of communities, most communities, I'm gonna wager, but I don't think it should be. I think it's a really important thing to work at your mind. Maybe the most important. So yeah, 8 months of therapy, and then once it still wasn't under control, I decided to try medication, which for me has been a really positive thing. There's lots and lots of stigma that go around medication. People say that it makes them zombies, that it fucks them up, that it's bad. And I know that has definitely been the case for some people, and it's not right for everybody, but for me personally, it was the right choice. I'm currently on 40 milligrams of Prozac and 30 milligrams of mirtazapine, which is a mood stabilizer and sedative, so I take it at night time, and it helps me sleep because I was having insomnia, and it also increases your appetite, because I'm naturally quite a small person, and I'm vegan, and I have a really physical job, and feeling nauseous all the time. I wasn't eating a lot, so I did lose a lot of weight. That affected my mood as well, because if you're feeling malnourished, I guess that can contribute to feeling a bit depressed as well. So I've been on medication for a year and a half now, and I didn't start on this dose. It was upped in increments throughout the last year and a half, and it's not always perfect. It's definitely side effects, but I think living medicated for me is a much happier existence than living unmedicated. And what I really wanted to talk about today, and I'm sorry this is going to be a long video because it's already 8 minutes, but I tried to make this once before and tried to make it short, and I can't. It's a long topic. Sorry. Thank you for bearing with me as well. But what I want to talk about today is some of the techniques that I've learned in the last couple of years to manage anxiety in its acute phase that doesn't involve prescription medication. Because I do take Valium sometimes when I'm having an acute anxiety attack and I'm in a position where I cannot go somewhere and calm myself down. Say like work or a social situation which I feel obligated to be at. I don't have time to sit and meditate and think and take some time out and have a lay down and whatever. So I'm going to share with you today just 3 techniques that I've learnt that I find really, really useful in managing like acute anxiety as it's happening. The first one is something my mum taught me, and I can't remember exactly the science behind it, but I find this really useful, and I do it a lot of work when I'm feeling anxious. I work in the kitchen, so like, it can be a really intense, stressful environment. So it's like, I wish I knew the science. I should have researched this before filming. But it's you clench the toes and release. Clench your toes and release. And you just keep doing this. Clenching your toes and releasing. And clenching your toes and releasing. And I do this a lot at work when I'm feeling stressed out. But I don't want to have a panic attack, and I don't want to yell at anybody, and I don't want to remain calm and professional. Clench my toes and release them. And this is meant to help circulation through your body, and I find that sometimes it gets a little bit of that frustration out. So I find it's really useful if I feel an anxiety attack coming on. I'll do that with my that's my favorite. Well, clutch my toes, release, clutch my toes, release, kind of over and over again for a few minutes, and I find that's a really good gripping technique in a mild anxiety situation. Another one that I think lots of people talk about, but I think they talk about it because it's useful, is just breathing, like breathing really deep breaths, because when you're feeling anxious, you tend to hyperventilate, so you kind of do this bit. But if you start to become really conscious of your breathing, you can do the nose and out through the mouth. It takes a while, but that can help you calm down as well. I often will just say to my boss, "Hey, Molly, sorry, I'm feeling anxious. I'm going to go sit outside for 5 minutes." And I'm really lucky. I work in a supportive environment, and I will go sit outside. At the moment it's really cold, which is good too. It's like cold wakes you up. But I'll just go outside and I'll do some breathing for a little bit and clench my toes, and I'll usually feel that I'll calm down and be able to go back inside and complete my job. The third technique, and this is one that's more useful only if you're at home, but it also is useful with a more severe anxiety attack, and that is, and this is something else my mum taught me, is it's something you should do laying down. You lay down and you slowly tense all of your muscles individually. So again, start with your feet, like you clench your toes, tense, and then release. And then you try your calf muscles and tense and release. And then your thighs and abdomen, and arms and neck and face, and slowly just tense small and then release them. If you keep doing that after a while, it seems to really alleviate some of this pressure. Obviously that's something you probably need to do at home. You can't really lay down on the floor at work and tense your muscles, but I found that really, really useful. And the other thing too is, I get prescribed Valium to help my acute anxiety, and I was really apprehensive about taking it for ages because of the stigma that goes along with it, and how that's like people get addicted to it, and like I know that street value for Valium is pretty good. But I also find just accepting the fact sometimes that I have anxiety and it's a medical condition that I need to deal with it, and allowing myself to take the medication that I need to fix it. I think accepting my mental health issues has been a really big step forward in managing them. I think if you fight, like I'm not feeling anxious, that almost hypes you up into a more anxious state. Letting it have a space in your body but not overtaking your body. I find useful of being like, okay, I'm feeling anxious and this is shit. But I know that I'm capable of, having a conversation with somebody, or going to meet this friend, or finishing this day at work. It might not be pleasant, but I know that I will feel a lot better about myself and about life if I can manage it. Not necessarily get rid of it, but live with it. Yeah. So I guess this is getting pretty long already. This is probably enough for Monday. I just want to talk a little bit about mental health. Open up a conversation about maybe how other people deal with it. And I also would like to make a video about how I deal with it in more of a long-term lifestyle kind of way. I'm no expert. I'm not a doctor. I'm a philosophy student and a cook. But I feel like if there's anybody that can find it useful, then I should share it. And thank you very much for staying through this 14-minute video. I hope everyone's having a wonderful, wonderful, non-anxious day. And yeah.